Hello everyone. Welcome to our new course that is on Certificate Program in Hospital Prevention and Control CPHIPC. Let's start with this course introduction. So, welcome you all, and I'm glad that you have reached till this stage. This is a practical and a career oriented course designated for healthcare professionals who want to build a very strong knowledge base with real world skills in the infection prevention and control strategies. This course is designated to help you understand not only the science behind infection prevention as well as how IPC can be applied in real hospital settings every day in every department. This is a very scientific, evidence based course grounded in microbiology and evidence based IPC principles. This is completely relevant to a hospital setting. The content is connected to the real world scenarios, and this is a career oriented, structured for professional growth and credibility certification. So, before we start, let's know a little bit about Steward Healthcare, the program coordinator for this course. So, we at Steward are a dedicated, decade long healthcare excellence organization. Steward Healthcare is committed to strengthening the hospitals and healthcare professionals through a very practical, system based support. Steward Health strength lies in combining the healthcare quality, hospital systems, and hands on implementation, making this training program a highly relevant and easy to apply one. So, our key areas of expertise range from NABH accreditations in quality systems, supporting hospital in achieving and maintaining the national quality standards, EMR and digital health solutions, driving the digital transformation across the hospital workflows, as well as we are pioneers in training and professional development. This is a structured, credible course built on real healthcare environment and based on the expertise of our lead trainers. Why do you think you should choose Steward for this course? So, Steward brings together a practical healthcare knowledge, hospital based understanding, and a structured learning design, creating a learning experience that is both credible and deeply relevant to your day to day settings. This is a practical content based course which is very easy to understand, and the material is built around real hospital scenarios. This course is very relevant to all the healthcare professionals who are working in the hospital, divisions across India. The credibility of the certification lies as it is approved and it's under the National Skill Development India program, and there is a structured support that you're going to get all throughout this course. So let's get started, and before we start, you need to meet your trainer. So, myself, Rupali, I'll be your lead trainer for this program. I have a healthcare professional experience of 13 years of expertise only in quality and hospital operations. I am a microbiologist by profession and do hold a MBA degree in hospital management way back in the years when it was very uncommon to do MBA in hospital management. And I come from a very reputed health hospital management institutions, so I have a dual expertise, right from my unique potential to lead this course, right from the scientific foundation that comes from my infection science and microbiological learning, as well as the hands-on experience from hospital systems quality and IPC implementation. So this certificate is going to build your confidence to 10x level. And one of the very common concerns for the learners is whether this certificate will you feel it authenticated, will it be professionally recognized or not. So before we start on with the course content, I would like to give it a minute to share with you the sample certificate that you get at the end of your course, clearly depicting the authenticity and credibility of this course. So we have been recognized by Medhavi University as the academic partners for this credibility of this certificate, as well as it's a government-based, government-backed Skill India development program, and I will just share the certificate sample with you. So this certificate, which goes directly into your DigiLocker app, clearly states that this has been approved by the government, wherein you will be getting a logo from Medhavi Skill University as well as NSDC logo and Skill India logo in it. As well as it will mention the training center or partner as Steward Healthcare India Private Limited. This certificate will also include your credit hours, and it will mention the total duration of the course. That has been another concern from all our learners, that how many, what's the duration of this course. So this course will be mentioned in hours based on the approved hours by Skill India government. So the credit will be 4 credit hours for you. This is just a sample certificate, and it will mention everything as per your Aadhaar card. It will have your enrollment number and even a QR code to validate that this is a valid certificate. So this is approved and will be recognized across India. So you can be rest assured that you are at the right place. Okay, so now let me talk about how are we going to conduct this course. What will be the model of apprentice for this course? So for this one, it is a self-paced training program, which means that you can learn at your own pace without losing the quality of the content. So this course is designated in a self-paced format, making it especially useful for all the working healthcare professionals who have to balance between their studies and the demanding clinical and administrative responsibilities. We do understand that balancing between your personal and professional life, always the studies gets up, backseat. So we have introduced this self-paced mode, which will help you to schedule it at your own terms. You can learn at your own time and pace, which works best for each individual. And it can be customized based on the individuals. So you can set your own time, you can schedule your own place, you can do it as and when you have time in your busy schedule. Also, you can at any time revisit and repeat and pause and replay or revisit a topic as many times as needed until it's fully understood. Also, the progress is with confidence because you move ahead with genuine understanding and not a time pressure or a focused deadline. So self-paced course, and and you can think about it as it will just be recorded videos. How will this be interactive? So it will still feel interactive because unlike all other self-paced programs where learners simply consume content and move on in isolation, this course is built in a more towards supportive manner and engaging approach. So there's a flexibility, and that does not mean learning alone. So how do we support you during this entire course content? You can at any time during the course put your doubts or queries or anything in the discussion section to ask questions at any point during the course, and we will get back to you with our responses, with the clarifications, with the links of any relevant material that you would like us to share with you, so you can stay engaged, still continue learning without being stuck and losing the momentum. And that is what makes us unique. So you are going to learn through videos, explanations, practical demos, and all the videos will be embedded into this content, and we'll ensure that this is not just a theory learning. You will have images, you will have videos, you will have a lot of real world scenario concepts to discuss. So the explanatory learning content is going to be broken down into clearly structured explanation that is going to build upon your understanding step by step. And there will be visual demonstrations in between to make your learning more interactive and more very interesting, I would say. So we will also include in this a lot of real world scenarios, hospital based examples, so you can relate to your day to day activities. Now, coming to the main course content. So, what are we going to learn in this entire course duration? We'll be starting with the very basic foundation of IPC, moving ahead to understanding the NABH, that is National Accreditation Board of Hospitals and Healthcare providers, their requirements based on the latest 6th edition of NABH standards for full accreditation hospitals. So we'll be talking about that entire IPC chapter in one of the modules, and then we'll move on to what are standard precautions, the usage of PPEs, hand hygiene, the very basic core fundamental information related to IPC. And then we'll move on to some more difficult and those parameters such as HI surveillance, how are you going to track that, the infection bundles, their calculations, their tracking, their audits, as well as waste management, sterilization process, very, very important, IPC infrastructure, employee safety, even antimicrobial stewardship, and that has been discussed in a lot of detail. So you're going to understand exactly what antimicrobial program is, what stewardship is, and then we'll be moving on to how are you going to implement these things in your hospital setting. So this is a very elaborative and a structured, very detailed and in-depth course related to infection prevention and control. And in this structured learning journey, this is going to be organized deliberately step by step so the learners can build understanding gradually. So we start from the very basic topics and then we move on to more detailed, more in-depth ones, and then at the end of it you will be more equipped and fully aware about all the IPC content, and the entire cycle will be completed. So when we say starting with the basics, as we have discussed, we'll be starting with the very fundamental terminologies, the scientific principles behind that, little bit of theory to start on with, okay? And then we move on to the core IPC practices, moving on to the surveillance and prevention structures, and then implementation, the practicality of it, and hospital application as well. So, how will the assessments and evaluation be done for this entire course? So, to make the learning meaningful and ensure that you have genuinely understood this course, we have a very structured assessment process at multiple levels during this course. So, at various stages, there will be some MCQ questions that will come up in between. After topic, there could be topic wise quizzes and puzzles or MCQ based questions to resolve. And then to have a more applied understanding questions, that there will be scenario based questions to make sure that you have understood the practicality of it, and not just doing the theoretical part. Then there will be a module assessments, that is structured evaluation based on every learning module. And eventually there will be a final assessment. Once that is completed, you will be getting your certificate at the end once you pass the final assessment, which I can assure you will be very easy if you are understanding each and every module with attentiveness. Please keep your note, pen, and paper ready to jot down your notes and understand and enjoy this learning journey. So, as all you all know, but just for awareness, and you can spread across the word, because once you start on this journey, we at Steward believe that spreading knowledge increases knowledge, and all of us together can build a very good ecosystem where all of us are aware about basic infection prevention and control. Because there's a hospital where you must be going, or your family doctor, and if you're not aware of what kind of practices, what kind of infection prevention and control they have in their setup, that is ultimately and eventually impacting each one of us. So it is that important, and it is of that much relevance to understand the practicality and the workflow behind it, so that we can ensure each one of us is safe. While we get our clinical interventions, we also are safe from all potential infections that we can get from a hospital setting. So we can, this course is very, very relevant for any nurses or infection control nurses, all the quality professionals, lab and microbiology staff, hospital administrators. This has a value for each one of the category. So let's begin our journey and build it with confidence. Infection prevention and control is one of the most critical areas, as I have just mentioned, in any healthcare environment today. A strong understanding of infection control and infection prevention and control improves patient safety, improves our safety, supports better hospital system, and strengthen the professional compliance and confidence of every healthcare worker who is practicing it day in and day out. So, practical, this is going to be a content that you can apply immensely in your clinical setup or any operational role that you are in. As we have already seen the sample of your certificate now, so you do know and you can rest assure everyone else that this is a credible, backed by a recognized university, and is going to be valid across in India. This is a very flexible course that we have already understood, and it is going to be a very professional enhancement of your career. So I am glad that you have reached this stage, and I wish you all the best for your course ahead. We'll now be starting with all the chapters and modules moving ahead. I can assure you that this is going to be a very attractive and interactive course for each one of you. I'll be there. You may not be able to see me during those videos, but I'll be there, and you can reach out to me via the discussion section. Drop down any comments, any queries that you have in your mind while you're reviewing this course, and we'll assure you that we'll get back to you with relevant answers. Thank you so much. Let's get started. And we are so happy and proud to be a part of your journey.